This is Larry Bauer, Chief Executive Officer of the Family Medicine Education Consortium, and I'm very excited to be talking with Dave Chase, someone I've known since 2013 when he came to the first Direct Primary Care Summit that we hosted, and he gave an awesome presentation that really rocked the audience. And Dave and I have stayed in touch over the years. We're both dedicated to the idea of transforming the U.S. healthcare system so that it better serves our nation and our people. He is co-founder of Health Rosetta, and he's also author of a book, a number of books actually. The most recent one, which I highly recommend, is Relocalizing Health. The future of healthcare is local, open, and independent. Dave, thanks for joining in. And what are you talking about? Health is local, open, and independent. We have nothing like that right now.
Yes, well, I'm a congenital optimist, but also very pragmatic. And we have adopted a system change model that's proven to be very effective in lifting tens of millions of people out of poverty and abroad, and then remaking a key part of the food system. The essence of that is you find what works. That's not easy, but it's not impossible. And so, you know, in many ways, I've been an archaeologist on dig the last dozen years, find what works, find who cracked the code. And with the system change model, it's you find what works, and then the real puzzle, because people are problem solvers the world over, right? That's not the hardest part. The hard part is how do you actually get that to replicate? And I use the word replicate versus scale. It's not about making one thing massively big. It's about adaptability and replication. And it's really hard to stop once you get it going. And so if you look at the places where they've had the tremendous success, it is where it's local. And local means a number of things, including health starts at home, right? It doesn't start in a pill bottle, it doesn't start in a hospital. Really, the ultimate local is the home, and health starts there with mom, dad, your neighborhood out there. The open part is how we've seen in other areas like technology, like wheat, like microcredit abroad. When people are open, it allows things to disseminate much more quickly, and people to improve off of each other much more rapidly. And that's really the essence of the organization and community we created with Health Rosetta, is we filter for people who are givers, you know, and have a give one, get 10 mindset. That's kind of the community ethos. And then the independent is, they're independent from, frankly, Wall Street interests and interests that aren't centered on the patient and the community and the home. And so those places that have done that, they're the ones who have by far the best health outcomes and are often spending 20, 40, 55% less. I know you just heard from Ashley Bacot. Really the main thing that, and Kenneth Aldridge from Rosen Hotels, the main thing that makes them unique is they've just been doing it longer than anybody else. So they've cumulatively saved $500 million. But they took that approach and went with independent TPAs and did direct contracts and really took ownership. And so that's kind of what I mean by that.
Now, you've coined a phrase, community-owned health plan. And the audience has just heard from Bryce Heinbaugh and Jim Lambros up in Ashtabula. And it's a nice model. It's a nice example of a community-owned health plan. Can you expand on that topic?
Yeah, and sometimes it's easiest to explain the concept by explaining the opposite, which is the status quo. Our mission is about empowering community-owned health plans, and the status quo is really that flipped on its head. We have disempowering Wall Street rented sick care plans. That is what we have if we actually unpack that. And so when you have this different approach, the design ethos of a community-owned health plan is it's purpose-built for the chronic disease era, not the old plans that were really purpose-built one size fits all around the communicable disease and acute care era. 80% of spending is around lifestyle driven disease. And success in that old model was about pleasing Wall Street. The success in this model is about improving health outcomes and reducing waste. In the old model, the use of profits are extracted out of the community. Take a community like mine with 250,000 people in it. So all in, we're spending about $2.5 billion. At least $1 billion of that is extracted out of our local economy for a fundamentally local service. So instead of that, in a community-owned health plan, the savings are really reinvested into communities. And we heard from Rosen, right? They've taken what others are squandering in healthcare, put it into amazing health benefits package for their employees. And if that wasn't enough, they invest in their community. We call that the Health Rosetta dividend. They were really the inspiration behind that. And rather than in the old model, is kind of the impact really being a death spiral, higher costs, worse outcomes, burnout clinicians. In a community owned, it's a virtuous cycle of lower costs, superior outcomes, really the quadruple aim, the much better for the caregivers, much better for the patient, better outcomes, lower costs.
Now, you and I have had a conversation, and I know you've been thinking about how do we transform, how do we go from small projects that are very successful, but by themselves, it doesn't change the big system.
Yep.
Going from the innovation and you get some early adopters, you've got to get to the early majority and actually to the late majority. And you've talked about the idea of creating a documentary that could really awaken consciousness across the country about what is possible. Could you share your ideas about that?
Yeah, I mean, it's such a big, overwhelming challenge in most people. Most people, walking the streets aren't healthcare wonks like we are. And we even have a hard time wrapping our head around it. And so the idea is if you can share the stories, the powerful stories, that's what film and media do. And if you look at the successful social movements over the last 50 years, whether it's better food or civil rights, there's this grassroots movement that happens really behind the scenes. And then there's a catalytic media moment that is really about resetting expectations. Any social movement, whether it's the idea of the US as an independent country, or it's about women's suffrage, you have to reset expectations. And that's where a film told through real life stories can be so powerful, where you can see whether it's the African American community in Orlando or the indigenous peoples in Alaska, or working class people in Ohio and West Virginia, like what's actually happening. And once you see it, everybody would want it. And that's where you look at those catalytic media moments, like Selma with, back then it was the evening news and the morning newspaper. You have like Super Size Me and Food Inc. These type of things awake consciousness. And so as we've been working the grassroots, things like what's happening at Ashtabula, we believe in the coming 3 to 5 years, which is about when it would probably take to get the film fully financed, produced, distributed, that it's ready to hit the mainstream at that point. And there's amazing filmmakers, and we look at the IMAX platform as a really interesting one. And we've teamed with the leading filmmaker that in the IMAX arena, where it's nice in that those films stay in there for a while and they draw in educated people. There's no doubt lots of doctors, lots of nurses are taking their family there. They're often co-located with a science center. And that's how we start to reset expectations. And once you compare the dystopian reality of today's healthcare system and the fact that something like the opioid crisis isn't an anomaly, that is our healthcare system. We're seeing the same thing repeat itself with benzos. And you compare that by comparison with what's happening at like a Rosen, it's like utopia by comparison. And so everybody would want that once they understand that. And again, with the power of story, you can change the public consciousness. And fortunately, the fixes aren't as complicated as people think. By design, our system is designed to be disempowering and complex so that people throw out the white flag. Once you show that, like we were just at Rosen very recently, Mr. Rosen talking about, they talk a lot about the KISS principle, keep it simple, stupid, right? Usually when you vary off of that KISS principle, you're going to have profiteering, price gouging, fraud, all these other things that pervade our status quo system.
So how likely is this to happen? Is this an active plan? Are you folks actively working on this?
Yeah, I mean, it's early stages. So I'm bullish, right? The fact that we have the leading filmmaker in the IMAX productions that has had gross receipts, only IMAX producer, probably by extension the most successful documentary producer ever, over $1 billion in IMAX receipts just on that front, is our partner on this. I'm bullish on it. We still have to get it financed. There's still a lot of work ahead. I don't want to say we're home free, but if you know anything about me, I won't give up. You know, I'm a dog on a bone. So if for some reason this didn't go through, it's taken us a while to get to this point, but having the compelling stories, which we now have with highly credible, highly accomplished filmmakers, that makes for a good story to funders and to ultimately, and the story is one that is incredibly timely now. If you look at the examples I gave you a few minutes ago, right? The working class individuals in the Midwest, you know, and around the country, African-American communities that were once ravaged by drugs that have completely transformed. You look at what's happened in Alaska with the Alaska Native people, and it's remarkable what's done. Almost seems impossible or unreal, but they've been doing it now for easily over a decade, and have some of the best outcomes in some of the most tough settings you can imagine.
So as I'm listening to you talk, Dave, I'm thinking, so here we are today, having this conversation with the people in this room, and here's the goal line.
Yeah.
And there's quite a ways to go. There's a lot of interference. There's a lot of just the fear of change alone, and of course the financial risk to all the people who are profiteering currently, who can put up a pretty mean fight. I'm wondering about intermediate steps. So I think you know that after I read your book and I found Bryce Hanbaugh in there in the story, and it was right here in my own state, I just had to, and I'm like you, dog on a bone. I just had to go learn about it. Same thing with the folks in Allegheny County. Said, oh my God, I'm going to Pittsburgh, you know, once a quarter, and nobody in Pittsburgh knows about this. And yet here are this incredible project. So what I've been doing to really, in a way, complement what you've been doing is I interviewed these folks and others. I've got about 25 now where I've interviewed them. I call them bright spots. We've written them up and we have a podcast interview so people can listen or they can read about the story. And I'm thinking that there is need for a community of people, an army of people who are finding the stories, getting the information, getting it to their local newspaper, getting it to the local physicians, getting it to the people who really want to advocate for change. And I'm wondering what you think about that idea and how we might build such an army.
Yeah, absolutely believe it. And it's one of those things with the system change model I alluded to, that's the first chapter in the Relocalizing Health. It's when you when you look at these problems at a national or global level, they seem impossible, intractable. But when you bring them down to the local level, it's very different. And one of the dynamics that we're seeing is, and frankly, part of that army is the folks that we have in our community with Health Rosetta, the benefits advisor, benefits broker role. I would argue is the most underestimated role in the entire healthcare system.
Absolutely agree.
And for better, for worse, right? When you have a Bryce Heinbach, it's definitely for better. There's a lot of opportunity, a lot of challenges there. And so we have people in virtually every part of the country that are part of that. But they need to, I had a call coincidentally earlier today with another advisor in Ohio who's working on earlier stage community-owned health plan in another part of Ohio. And she's very credible, but she is working with civic leaders, city leaders, business leaders to do this. And then the other reason, the other thing that's going on is we've been working pretty diligently behind the scenes to build these successes, because successes is actually what persuades people. One, you have a vision of where you want to go, but it also gives people belief that you can actually have success here in a field where it's been riddled with failure after failure after failure, and so-called solutions often make things worse. And what we see is kind of a sort of a rule of threes, where you get three employers, three organizations in a given area, and they do it. And they're having the kind of results that Bryce has shared. Nobody really notices, but you're building muscle in that community. You're understanding the local landscape. Then you get 3 times 3, 9. You get 9 employers doing it. Some people start noticing. You have some case studies. Some providers who didn't know how to look at this card that wasn't some expensive national logo go, oh, not only do we accept this, we embrace this. These are the great plans we like. And then you get to 27, 3 times 3 times 3, and that is typically about 5% of the employers in a given locale. And that doesn't sound like a lot, but it's game over at that time, because you cannot shut the mouths of the CEOs who are spending 20, 40% less with better benefits, better health outcomes, and it becomes an unstoppable force in that community. But then other communities learn of that. Bryce has had auto dealers from all over the country call him because he got press about one of his auto dealer clients. He's got people in different cities. He's just one example. And so that's how these things spread grassroots. And so that's how we think you can build that local army, because there's people then become really vested in this, and they will not give it up. You could not take this away from Rosen. You could not take this away from the South Central Foundation. And their community, they're such strong believers in it. And I think the roots of that are this grassroots belief and long-term commitment that then make it doesn't matter, like you said, a hostile environment. Yeah. And, long field. Yeah. But even, Tom Brady, can win in a very hostile stadium, even though he's got to go from the 5-yard line, right? You have the right team with the right leadership, the right passion, they can drive down the field and succeed.
So I'd like to go back to a point that you made it really astounded me. So, I've been in our organization, the FMEC has been a supporter of direct primary care since we first found it back in 2008. And I can't tell you the number of conversations I've had with docs who are practicing in a DPC model who have been trying to talk with local employers and having little success. We, in another stage of our organization, we created something called the Primary Care Innovators Network, where we were bringing employers in a community together with the DPC docs to help them have a conversation. And what fascinated me is that the conversations went like this. The docs were talking about this stuff, and the employer community was talking, and they were passing each other right out in the open. You could see it happening. When I learned about your Health Rosetta trained brokers, and I saw what Bryce could do, he had conversations with employers, and he was credible to those employers because of his background and his training. Whereas if Jim Lambros, the family physician, had walked to those employers and tried to have that conversation, it would have gone nowhere. So I've been telling the DPC community, and I've been telling any docs who really want to change, that they need to find a Health Rosetta broker and begin to let that person be their ambassador. The docs don't have to do, even the independent docs don't have to do that heavy work. They've just got to be partnered with somebody who's truly an ethical broker. So that was just a brilliant idea.
Well, and you know, to torture that metaphor a little bit in the communication, you do need that translator, right? You need somebody who can talk to the DPC doc and can talk to the employer, so you're not, you know, ships passing in the night. And it does make a big difference. But I wouldn't discount the importance when that teaming is happening of the physician, right? Because they are, I mean, the three most trusted professions in America: nurses, doctors, pharmacists. And the docs often have relationships, patient relationships, neighborhood relationships, church relationships with business owners. So if they can come with the right folks and put the pieces in place, as you know, having seen this journey of DPC, you need the other elements. You need the access to hospitals, you need the drug plan, you need the risk management structure. And some of the stuff is kind of boring and stuff that nobody in med school ever learns about. But if that's not in place, they just can't wrap their heads around just doing this one piece of it.
So what would you say to the people in this room who've now got it? They heard Bryce, they heard the folks from Allegheny County, they heard from Rosen, and they're hearing from you, and they go, yeah, you know, this is what we've got to do. What would you suggest to them in terms of first steps back in their respective communities to take these ideas and bring them to life in their respective communities?
Yeah, I mean, you definitely spoke to one of them, which is, you know, establish relationship with locally credible, ethical benefits advisors, you know, and they're not exclusively with us, but we have most of them, which is you go to healthrosetta.org/map and you can find them on a map. And, you know, now some of them are at various stages of the learning curve. Not everybody is where Bryce is at. So, you know, you may need to do some education even with these people who are aligned. So I don't want to oversell where everybody is at in that journey. But that's a really important step, is find those local allies, certainly out of our community, but in other places. And then, you know, get educated. Certainly, I mean, I allow my books to be downloaded for free. You can buy them in your local bookseller. And so there's some good resources there. You know, like your Rick Steves guide, you know, of like how to navigate this terrain. And then, but don't give up, right? It's not easy. It's not a quick journey. Bryce will tell you that even though he's having a lot of success, it's not like it's an unbroken string of victories and first downs on, you know, first down, you know, every play. Right. And so you gotta hammer at it. But the thing that you see with people like Bryce, like with Kenneth and Ashley, is they have made this transition that is amazing when you go through it, which is, you know, it's great to have a job. It's better to have a job than not have a job, but it's much better to have a career than a job. And a lot of people are at that point, maybe they have a career, they had some success. You know, Bryce had a good, solid career, but it was in the old model. The magic happens when you have a calling, right? Calling is much better than a career. And then you realize the human impact that you can have in your community. And it doesn't matter some of the noise from other places and naysayers and all that, you will not give up. And that's where many of us are. And, the old cliche, you don't work a day in your life if you do what you love. It's very true there. Again, you get lots of bumps and scrapes and black eyes, but you just keep coming at it. And so that would be what I would suggest, get a little more educated, find the right Sherpas, or GPS or whatever metaphor you want to use. Don't go it alone. But there's definitely a lot of aligned people. And that's a lot of what we created, is just people didn't know there were others like them out there. I know you do that with your organization, but then finding people in the complementary spaces that are sort of like that, the FMEC, the primary care innovators, but on the kind of business side of it.
So Dave, I'm going to bring things to closure here. I appreciate you spending the time and sharing this, really the wisdom and the experience that you have. I've been so impressed as I followed you since I first got to know you, the work that you're doing, and I have no doubt that there will be a documentary. And if there's anything that I can do or our organization can do to help that along, please don't hesitate to give a call.
Yeah, absolutely. Well, thanks for your ongoing commitment to transformation and education and primary care. And, I know we're all preaching to the choir here that there's just no well-functioning healthcare system in the world not built on proper primary care. And fortunately, there's now some wind in our sails that wasn't there 10 years ago.
Hey, thank you very much.
You bet.